right. Let's everybody hop on. Try to start on time today. No, I'm not going to accept any requests to be in my video. I don't know why everybody does that. It's odd. All right. Hi, Dr. Whitfield. Oh, thank you. Who's this? Vanessa. It's great to see you. Oh, Vanessa. Where are you, Miss Vanessa? Vanessa knows how old I am. I'm 56. I've been operating a long time. So she said a long time ago. I don't know why. Hold on a second. I'm going to turn off and restart the TikTok. I don't think oh, yeah. I hadn't started the live on TikTok properly. Sorry. Oh, I did your explant in 2018. Yes. It was a very long time ago. Well, I can't stop and look you up, but I hope you're doing well in Fort Worth. All right. We're letting everybody hop on. Barbie, I don't know about Corpus Christi. I'm in Austin, so if you're in Corpus, you certainly can do virtual with us if you'd like. Maybe that can help you. B.1 BYBRI. What type of kit? So we have two. We have the kickstarts and we have the full inflammation support bundle. If you have nobody guiding you, you might want to keep it simple with the kickstart. See, if you're interested, we have a group program for Sharp, which is my program. All right. We are live in Facebook, Instagram, TikTok, and YouTube. However, I have only 4 people out of the 2 million subscribers on YouTube. All right, we'll let everybody hop on here. Let me see how many people we got. We have... All right, well, let's get started. Today I did a podcast, and it was an interesting podcast. And I told them that I was doing a Instagram Live tonight. And they encouraged me to share what I had shared on the podcast. So, for those of you who don't know or are just learning about um, some of the types of things we've done at our clinic and in my career, so I'm Dr. Whitfield. I'm in Austin, Texas, a board certified plastic surgeon. And the majority of my career was spent really training to carry out complex reconstructive surgery for cancer. And that was a ton of meaningful work to me, and I was very passionate about that. My sister passed away recently of breast cancer, and the large majority of my career was devoted just to cancer reconstruction for head and neck cancer, sarcoma reconstruction, and breast reconstruction. And those were some of the most meaningful experiences I ever had. So that led us in 2016 to be approached by a breast cancer patient who wanted to go flat. And so going flat and having an aesthetic flat closure is more common now than it was previously. I did her case, and I did all these cases the same way as I was trained. And so when I was trained, we removed all the scar tissue and sent it off for two things. One was an analysis to look to see if there was any residual cancer or recurrent cancer. And the second was to look for bacteria, fungus, mycobacterium. Those are things you would find on the microbiology reports. And this patient in 2016, at a week, we saw the patient. She had no evidence of recurrent cancer, which is first and foremost the most important thing when you're taking care of those patients. And second of all, when we reviewed the microbiology report, she had an E. coli infection. And she had no redness, no swelling, no pain, no tenderness, and had no evidence of capsular contracture. We can talk about that later, but it was something that was super frustrating to me. I didn't, or had not at that point in my career, ran into somebody who had a quote unquote silent or indolent infection like that. So I believe this patient put me on a Facebook group, and the rest is history. Patients started self-referring to us to have their implants removed or unaugmented, whatever you want to say, unconstructed. The kind of next steps, and somebody, Vanessa's from 2018, so that's within the first couple of years of me starting to do explants for really cosmetic patients. I had done them for cancer patients either through an aesthetic flat closure or something that I did and taught people to do in training, which was a deep inferior epigastric artery perforator flap. It's where you keep tissue from the abdomen, and instead of discarding it like you would in the tummy tuck, you keep it connected to the blood vessels and use the skin and fat to help do breast reconstruction. So I was taking care of this problem before I knew I was taking care of the problem, really. So implant-based reconstruction or implants used for cosmetic purposes certainly can get infected, and we can go through, briefly how we think that is really happening. So there's three opportunities for an implant to get infected, whether it's a hip, knee, breast, dental, whatever the device is. When you take an implant out of a package, there's it's got two packages basically, the outer and the inner. So they'll open it and give it to the staff in the operating room. And then the final person to open it and say use a breast implant, in this case, is the surgeon typically. And they perform usually a no-touch technique, typically with whatever they were taught, whatever they're most comfortable with, to limit the opportunity for contamination. So they can contaminate when they open it, They can contaminate when they give it to the surgeon. Surgeon can contaminate when they put it in, or putting the device in. All of those are really low. There's a lot of care, and uh, it would be very uncommon for that to happen in those steps. What is more common, what is the most common way, is at some point in that patient's life after placement of the device, they become bacteremic. And so bacteria can get into your tissues through a cut in your skin. If you had a cold, uh, if you had a urinary tract infection, a GI tract infection, a sinus infection, you could get bacteria in your system. That gets in your bloodstream. It will ultimately, if your body recognizes it and can get it out, it will get it out. But if it attaches to the surface of the device, your body can't really clear that. The device is not alive, it doesn't have blood flow. So just trying to clear it is hard for your body, and many times obviously can't be cleared. Um, Many of these bacteria readily produce biofilm. Think of biofilm as the plaque on your teeth, and it makes it hard for your body to deal with it. It signals that it's there. Your body knows it's there and it's trying to get rid of it. Creates a lot of inflammation around it. So the point of this is, if you have a device, hip, knee, breast, dental, cardiac, neurologic, they all can become infected. They all could get bacteremic. Everybody who puts in devices at all as a surgeon knows this. The thing is, now we have a little bit more information in terms of the number of patients affected. So in September of 24, um, basically we looked at a series of our clients of over 690 consecutive explant specimens. PCR analysis, remember from the pandemic, an antigen test, PCR test. PCR is more sensitive and specific, looking for a single copy of DNA. Those tests revealed that 29% have bacterial contamination on evaluation. So almost a third of the scar tissue specimens we explant have this bacterial contamination. So what does that mean for patients? Mithun Sina, who's a scientist at Indiana University Medical Center, showed that oxylipin-10-home, which is a biomarker in the blood, is elevated in patients with more symptoms with breast implant illness. So there's now more of a cause and effect. In their study, they had more bacteria of Staph epidermidis. In our study, we had more Cutibacterium acnes. Either it readily produces biofilm. So you have bacterial contamination, you have this oxidative reaction between the bacterial biofilm and the fatty acids in the breast, leading to oxylipin-10-home. Oxylipin-10-home goes downstream and affects macrophages and causes macrophage polarization. Ultimately, that will, basically, let's just think of it, lead to more symptoms. And the symptoms we're talking about, neurologic symptoms, light sensitivity, sound sensitivity, short-term memory loss or brain fog, ringing in the ears, kind of chronic problems with sinuses, difficulty swallowing, dry eyes, shortness of breath, chest pains, palpitations, tightness, muscle pain, joint pain, just aches, tremors, vibration type symptoms, urinary tract infections that are recalcitrant to treatment, meaning like they just keep coming back, and it's not so much probably an infection as it's an irritant or inflammatory type process. Some people get diagnosed with cystitis, lots of GI problems, constipation, diarrhea, bloating, swelling, cramping, all the things, skin rashes, eczema, like just on and on and on. And so we have this, collection of chronic inflammatory symptoms, and then what can we do for the patient? So many patients, after trying all different medical therapies and getting worked up, which is always what you want to do, want to make sure everything's ruled out and know what's going on. They want to have their implant removed, be unaugmented or unreconstructed. So I've taken down reconstructions, done aesthetic flat closures, I've done removals, I've done removals and lifts, I've done removals, lifts, and fat transfers. And I think if I had the best case scenario for each patient who's trying to live or change up, if the implants no longer align with them and they want a more holistic or natural lifestyle, then using their own fat as the filler becomes my my kind of default plan or plan that I think about to help patients, because you're resolving a big conflict by taking volume out and adding a little bit of volume back and doing a lift. So if someone wants to come and have a simultaneous fat transfer, which I think is totally achievable, it's more of a patient selection rather than a limitation of technique or anything like that. So we look at patients pretty intensely through a number of tests, and many patients are alarmed, but I wrote about them all in this book, The Sharp Method, and we did a little mini course. You can go to drrobsolutions.com, drrobsolutions.com, or you can go to my domain, drrobertwhitfield.com, and you can get a guide. You could get the book if you want. It's very simple to read. It highlights what I'm going to tell you. So your genetics allow you to detoxify, and then everything you get exposed to every single day, either from your environment, so the air you breathe, the fluids you drink, the food you eat, everything you put on your skin. Your body has to cope with all that. And that profile of toxicity burden is very important, as is your gut health, sensitivities to all those either things we apply to our skin or foods we eat, sometimes things we drink. And then our hormones, we have to have, I would say, more hormone balance, better balance to do what I'm talking about. So I like to do simultaneous fat transfers in those patients who I've reviewed all that data. And I also look at a DEXA scan. So DEXA scan looks at their BMI, gives us their lean body mass, gives us their body fat, and bone density. So armed with that, I feel very good, depending on what I find, to prepare patients to have simultaneous fat transfers. So first and foremost, that's very achievable. You don't have to wait. If in fact we see you and I feel like we can get you prepared properly. We have lots of examples of people who had problems with toxicity levels, including mold, and we helped prepare them properly, and they've went on and had simultaneous fat transfers with or without lifts with very good results. Several have been on our podcast, and you can go to YouTube and type in Dr. Robert Whitfield or Robert Whitfield MD and go to my channel and go to the patient story section and see patient stories. Just an explant story will be one, like Taylor Dukes. An explant and lift story is like my patient Lauren Bostic, who hosts the Skinny Confidential. And then we have multiple simultaneous fat transfer patients who've been on the show, including Casey Dixon, Madison Miranda, Alexi Panos, Jessica Brassington, and Brooke Okeechobee. Probably said Brooke's last name wrong. I'm sorry, Brooke. But nonetheless, I feel like that's the best way. So this is a complex problem, one of imbalance, right? Sometimes there's hormonal imbalance, sometimes there's GI imbalance, sometimes there's toxicity burden imbalance. But in general, oh, hi, Erica. Erica's a phenomenal explant patient of ours. She's been on my show for explant only, so please check her out, Erica. Raina, she is phenomenal. Does a great job. So um, the simultaneous fat transfer. So, okay. So where do we get fat from? We do inner and outer thighs typically. We do the love handle area, the waist area, and then we do abdomens, but you have to be careful with abdomens. Abdomens can become looser very easily, so that's a case-by-case basis. We can always typically improve the skin and help with stretch marks and looseness. We prefer to use Body Tight by InMode. It's a bipolar radio frequency device for skin tightening. And then for stretch marks, I just combine that with morpheusate microneedling. We've had that for long periods of time. We do those simultaneously as well. So simultaneous fat transfer, you want to get enough volume to transfer. So think of strategically, there's 3 areas that get fat transfer. Anatomically, we do faces, but when you do a face, it's very little fat, and you usually want to have it much deeper, because anything superficial will be easily visible. You don't want that. The buttocks is a very common place for fat transfer. Brazilian butt lift is a fat transfer to the buttock. Now, the buttock is such a large area, so you got the gluteus maximus, which is the muscle, and then deep fat, superficial fat, but it's a much thicker area, much larger area. And if, in our experience, typically, if you didn't put like 500 cc's per side, a half liter per side, it was hard to see a visible change unless somebody wanted a very small filling of a hip dip or something like that. The breast, if you think of it, it's a much smaller surface area on the chest. And so I always think of it like you have a pocket on the front of your shirt. You can only fill that with so much before either things start coming out of the pocket or it tears or something like that. So beneath the skin, but above the breast tissue, is the fatty plane on the chest and where the breast is. And so that's where fat belongs. It doesn't go inside the breast. You don't inject fat into the breast. That will make cysts. It can cause problems. The fat doesn't go where you typically are removing an implant from, because most of the implants placed in North America are typically behind the muscle. You don't want to put fat in there. You want to put the muscle back down, try to get it in its anatomic position. And so typically you're transferring anywhere between 200 to 400 cc's depending on the size of the breast. Have they breastfed? Have they had a previous lift surgery? How big are they? How much breast tissue do they naturally have? They're all factors that contribute to how much you can place. But if you help with reshaping of the inner outer thigh, the waist, and around the breast, then that helps really improve a lot of different areas. And I call that really more of the holistic mommy makeover, where I'm taking out something that's been augmented with a device and doing a lift and fat transfer, or somebody who's coming in who doesn't want any implants, has had kids, has had some loss of volume secondary to breastfeeding, and wants to have a fat transfer or a lift and fat transfer. Same logic applies to that. So there's always going to be these questions of how much retention is there of fat. So I like to think that fat has the best opportunity to be retained if someone keeps their BMI stable or comes up a little bit versus their BMI dropping. I recommend patients don't do things outside of strength training and walking or Pilates or yoga or things like that, because cycling, running, HIIT, high rocks, CrossFit, all those things are much more higher in intensity. So For me, I really enjoy the problem solving that goes into getting someone prepared for and executing the steps involved in the patient selection and pre-op process of either a holistic mommy makeover where we're taking fat from all these different areas and adding it to the breast with or without a lift. Oh, we should talk about lifts. I have a great patient. She'll probably hop on the show at some point. We won't call her out right now. But she came, she's diabetic, and she didn't want implants, just wanted a natural holistic treatment with fat. We did that for her, and she's now, I think for the first time in a long time, she's super comfortable in her clothing and is very happy with the procedure. And we had to discuss like lifts create scars. If the scars are not going to be super beneficial, then we just don't want to create that for the patient. Those can be done later if in fact needed. So I do a vertical lift if someone has a wide breast that needs to be narrowed and lifted. We can do a circular lift if someone has a widened areola, or if we're just trying to apply a little bit of tightening that's circumferential towards the center. Anchors I reserve for people who definitely had an old anchor type scar, or they're going to have so much skin redundancy that we're going to have to do something. And we're recommending those more in our patients with larger and larger implants. We've had to do some skin work on folks with 600s and 800s, and those are obviously very large implant sizes. Most people are, on average in the 300s, the 350, something like that. So now we need to go into a little bit of detail about how we prepare people. So if someone's got a lot of planning to do and isn't going to be here for 6 months, my detox practitioners are all ready to help really get people prepared for surgery. We do limited amount of treatments. We use CellCore for detox. We are very careful preoperatively with patients, not trying to get them to detox too rapidly because that leads to Herxenheimer type reactions. So we don't want to have anybody become unwell from that. I'll mention sauna because I get asked about it all the time, because I did a podcast with Lauren Bostic about her use of sauna. I'm located in Austin, Texas. Somebody's asking where I am. So Lauren was using her sauna. Her sauna got up over 200 degrees. She would use it multiple times a week for an hour, hour and a half at a time. And she was leaching heavy metals out of her device shell into her system. We found this on her total toxicity test, which is the worst one I've ever had from a patient. She had multiple heavy metals, and after we did her explant and retested her, all those were out of her system. So I just have patients pause sauna if they're not feeling well, and whether it's a barrel sauna like she had or an infrared sauna. And then if someone is intent on having a fat transfer, I just have this talk with them. I don't have good information about what to expect after fat transfer with sauna. So hold on. Somebody's asking me a good question here. Gina is asking, she had an explant in October. When should I start trying to get pregnant? So I've had patients get pregnant the month after explant. So you have to decide that for yourself, but that's as quickly as I've had somebody get pregnant. Okay, so back to what was I saying now? I lost track here. Saunas. Sorry. Okay, so saunas. I think we just have to be more thoughtful about it. So if someone doesn't feel well after a sauna session, then you just don't do that. You just pause it and give yourself time. I think my patients are so aggressive about wanting to feel better and doing detox and doing protocols and doing supplements. It's very complicated. We have a very specific set of supplements, and the supplements we rely on most are D3K2, vitamin C, glutathione, methylated B. I have those in a liquid liposomal formulation on our store, Dr. Rob Solutions. And the reason being is I have so many patients with absorption issues. Now, the the liquids are easy to take. You don't need the kind of so many tablets, pills, tinctures. If you just do these basic ones, and then we have a couple powders. I do promote a really, really high protein diet. And healthy fats are good, of course, if somebody's entertaining, like trying to have a fat transfer. So I was getting asked today on the podcast, like, what are the healthy fats? Avocados, olive oil, nuts, and seeds, and things like that. There's just not a ton of them. So in addition to healthy protein sources, I get asked about collagen all the time. So collagen can be great for hair and nail growth, but from a protein standpoint, for what we use for surgery, we don't recommend that. We use pea protein or like a bone broth protein or some other protein that has a better protein score. So we're doing all this pre-op, right? We're doing all this work. We're getting prepared. We're lowering inflammation. We're trying to achieve better sleep by doing 3-2-1. Stop eating 3 hours before bed. Stop drinking 2 hours before bed. Get off your phones an hour before bed. Get your room cool. Get your little noise machine on if you need some white noise or just some sleep app noise or something. Get a sleep mask. If your room's too bright, it has to be a little bit cooler, of course, like I said. And then try to get off to sleep. You need to get this length of sleep that's going to help you recover. If you're interested in, what my patients tell me is many times they have so many problems that they're getting up in the middle of the night to go to the bathroom pre-op, and that shouldn't happen to you. I really think if you start following some of those guidelines I mentioned, that you'll sleep better, you'll sleep longer, and that will help you. The first and foremost, the first and most important thing in recovery is sleep. You recover when you sleep. So that's paramount. And then, if we get your diet right, we get your rest right, your hydrating right, and that's not drinking 9 Stanleys, full of fluid every day. Just that's not going to solve the problem. Then you make it to Austin. Preoperatively, we see every patient and we confirm everything, go over the plans, and set expectations about, coming into the office, what we expect you to do, and participate in the program. The night before surgery is important to us because I like to be prepared and help patients get a good night of rest. So we have a couple medications. One's for nerve pain, inflammation, and nausea. We have them take that the night before. And then the morning of surgery, they come in, I see everybody, I get them marked. And at that point, we kind of turn everything over to anesthesia. Our anesthesia team, they're phenomenal. They do everything they can to help our patients, whether it's our fat transfer patients, explant patients. They do specialized nerve blocks for us under ultrasound for both explant and our fat transfer patients. So if you're just removing an implant, we'll have them do a serratus anterior block. And if we're doing other areas where we're taking fat out of different areas, we'll have them do blocks to help with the thighs and the love handle area, the tummy, whatever we need, they're going to help us out. So our patients typically have a lot better pain control, a lot less nausea, because the anesthesia folks are not giving narcotics during the case to help control pain or anything like that. We've already got this working. And as soon as we visualize an area, I think of the removal process as I'm looking at a pie chart. When I get a quadrant open that I can see visually, I'll numb that area. We use a combination of short-acting, long-acting, local anesthetics. Hopefully everybody's familiar with or learning about something like Exparel. We use it all the time in our practice. Really helps control pain for the first week. Then, of course, everybody has pain medicine if they need it. But importantly, they come to my office the next day. So we are the only clinic in Austin with a human regenerator. So the human regenerator is this big bed you lay on, and it helps create a better, think of it more like a parasympathetic state. Calms you down. If you don't feel well, it makes you feel better. I always feel better on my human regenerator. I try to use it. If you follow me on Instagram, you'll see me. I tend to post it about it here and there. After that, do lymphatic massage. We have 3 flow pressos from New Zealand, so it does basically the body. We don't do the chest because if we're doing surgery there, if we've done a fat transfer there, we don't want to provide any compression in that area. So we do the tummy area, the thighs, the whole leg, actually, including the feet and arms. So that really helps efficiently get fluid out. We don't use drains. We just rely on the body's lymphatic drainage system and all the measures we take preoperatively, along with diet modifications, to allow our patients to clear their own fluid. The next thing that I really like, while you're doing the flow presso, you have Nano V blow by. So it's really great for protein synthesis. Then we have a vertical hyperbaric chamber. So hyperbaric oxygen, I think, is great in terms of recovery. Healing tissues don't have as much blood flow, therefore they don't have as much oxygen. So they're more susceptible to infection. Infection sets up easier in tissues that lack oxygen. So we want to add oxygen to those tissues. So that helps in terms of healing. We've had patients tell us they really experience a lot less pain at the areas we take fat out just with the use of hyperbaric oxygen. I think it's more a combination between lymphatic massage and hyperbaric oxygen. So the next and kind of final thing we do right now is red light therapy with Juve. The Juve is 6 foot tall, so you just stand in front of it. Red light is good for inflammation. It's also good for hormone balance. The next thing we will add will be something to help in terms of greater sound therapy. I think sound is really underappreciated in terms of its power and effect on healing. So I have a lot of friends who do a lot of great work with sound, so we're anxious to have something like that in our program. And then I have patients here in Austin about a week. So I'm in Austin, Texas. So if you're coming from out of the country, people stay 2 to 4 weeks typically. If you're coming from in the United States or Canada, it's typically about a week. I have a patient in town who is going to just spend a few weeks with us because they want more self-care. So if patients are doing that and wanting to spend more time, we have more packages available to help with those extended lengths of stay. We have a full staff. Have 3 folks in the front just helping take care of patients and get them kind of running through everything. Our medical assistant Millie is phenomenal. Our nurse practitioner Violet, patient concierge Alex. I've had the same surgery tech Daniel since 2018, really. So Vanessa, he would have helped operate on you, or help me during the case on you. Yeah, we have a whole team set up here in Austin to take care of everybody. So with that, I will take a few questions. G just had a fat transfer this morning, so we will see. G, I did not do your fat transfer, but okay. Has anybody got the... Thank you, MJ. Yes, I do have the best team ever, for sure. 100%. All right, I guess I could scroll back here and see if I got some questions. All right, how many people do we have going here? Let me go through these questions here. All right, do we have... Does anybody have any questions? You can type them in the chat. Uh, Somebody asked if they should include alien abductions in their medical history. That's an interesting one. I haven't had that question before, but okay. All right. Anything else here? Cancel. Yeah, usually I get a bunch more questions. I got a question about the muscle. That's great. So above the muscle, obviously you're not doing anything within 1 to 2 weeks. You're typically fine. If it's behind the muscle and the muscle requires repair, we give everybody a 6 to 12 week protocol where we're just allowing them to heal up because we want that to be healed, and then we have a protocol to resume activities after that. That protocol is actually designed by one of our patients. Just as, does fat transfer stick or does it get resorbed in the body? So when you transfer the fat graft, it's in a liquid form. So there's going to be absorption of some of the fluid. A bunch of the fluid is drained off, but you can't get all of it. And then everything has to heal. So it's more of, I try to explain it this way. If we have better balance, if we keep our diet, our activity, our hormones, if we're in better balance, our guts are doing a better job. Like, all of those things allow the healing process to be its best. And all things being equal, if you can keep your BMI and those other parameters balanced out, you'll maintain, in my opinion, somewhere between probably 60 and 80% of the fats. But if you drop your BMI, if you lose balance in your calories or training that balance, if you say created a big calorie deficit, you're going to lose fat. So. Jess, I'm glad I answered this question for you. You asked it a couple times. Would BII make your hair fall out due to inflammation? Oh, there's so many things that are causing inflammation. Certainly, chronic inflammation is going to affect, think of like anything that affects your hormones, especially your thyroid hormone. You definitely could lose your hair. I've had people do a lot better once they come back into more hormonal balance. And that's definitely, part of the issue with that. Ashley, I don't see all of your questions. It says, would you suggest someone doing a fat transfer with the explant if they are actively? Then it stops. All right. Anybody on TikTok? Jacqueline says she has a lot of allergies, has been trying to detox. Yeah, I mean, that's pretty common, Jacqueline. For sure. Oh, okay. All right, I gotta read. We just trying to conceive. No, I mean, I've basically, when folks are trying to get pregnant, I've minimized what I've done. So they're not trying to recover from more surgical sites or anything like that. Gotta just do it case by case. Gina, I don't know what case you had there. All right, what else do we got here? We've got a fairly strange number of things on TikTok. My doctor removed the shell on the ruptured implant, but not the implant that wasn't ruptured. Yeah, I always worry about ruptures just because it's hard to get all the material out completely. I think all of that makes sense. Any debris in there could still be, stimulatory to your system. So, do I got anything on YouTube? Like, you guys on YouTube are just sad these days. I don't know why. And then on Facebook, what do we got? All right, that's it. Anything else? I'm a plastic surgeon, at least. We've been talking about unaugmentation or implant removal and unreconstruction or aesthetic flat closures, and my program, The Sharp Method, and my books, The Sharp Method and the BII book, and our courses. We have 3 courses: Fat Transfer, BII, The Sharp Method. And we have a big group program, so if you can't come to Austin for surgery, my practitioners want to run a group program for patients explanting elsewhere. Oh, I'm sorry, Wendy. Yeah, I know that's tough. Sorry about that. All right, y'all. So if you want to learn more, go to drrobertwhitfield.com or go to my YouTube channel, Robert Whitfield MD, or just type in to YouTube, Robert Whitfield MD. You can go get a lot of resources on our store as well, Dr. Rob's Solutions. So DRROBSSOLUTIONS. It's also accessible from the main website. And what else do we have? What have you done that I'm forgetting here? Oh, the podcast. I'm sorry. So if you want to listen to us on Apple or Spotify, just type in Robert Whitfield MD. I'll pop up and you can go through the podcast. I think we have over 150 podcasts up and a little over 3,000 videos. But patient stories are probably the most valuable if you want to hear about explant or explant lift. The explant story is probably that's up and probably favored or watched the most is from Taylor Dukes. Follow her on Taylor Dukes Wellness. And then for an explant lift, it's going to be Lauren Bostic on her show, The Skinny Confidential. Just type in Lauren Bostic and Robert Whitfield MD, and I'll pop up with her. And then for fat transfers simultaneous with removal, it's going to be Casey Dixon. It's going to be, oh my gosh, I forgot, explant alone, Eric Arena. Sorry. It's been a long day. 2 explants, a podcast, a bunch of meetings, and now live. So the other simultaneous fat transfer podcast, Madison Miranda, Jessica Brassington, Brooke. I'm forgetting somebody. Oh, great explant only is Casey Rauho. So I have all sorts of great patients, really. Love having everybody pop in. We have a private Facebook group. You can type it in Facebook for explant surgery or breast implant illness. I'll pop up. Give us a follow on Instagram at Robert Whitfield MD or TikTok at Robert Whitfield MD. Facebook, Dr. Robert Whitfield MD. And then on YouTube, our channel, Robert Whitfield MD. Yeah. Anything else before we go? Is that it? Let me see. Oh, wow. I missed a bunch of stuff over here. I'm sorry. Yes, Lorraine, you can do that. Just double check with your surgeon, make sure it's fine. Y'all are so welcome. Thank you for hopping on. Look forward to talking to everybody.